Welcome to UNCAGED. Today we're speaking with Frank Emory. Now, Frank is the Chief Legal Officer at Novant Health. You can imagine anything in the health space. There's lots and lots of stuff to talk about in terms of privacy and compliance. Novant Health is a leading healthcare provider. They have over 15 hospitals and more than 350 physician practices offering advanced medical treatment across the state of North Carolina. We'll talk about where Novant Health is right now, but more specifically, the legal piece and what Frank and his team are working on. But before we get there, Frank, tell us a little bit about you and your career.
Oh, well, thanks. Glad to be here. So I'm a North Carolina native, grew up watching Perry Mason. And so I wanted to be a lawyer from the day I went to college, and I ended up doing that. So for most of my working career, I was a courtroom litigator, tried more than 100 cases all over the country to verdict and many other cases that I've handled. So I did that. And then about a little over 5 years ago, I had lunch with our CEO, me thinking that I was going to get some business for my then law firm. And he said to me, well, have you ever thought about doing something else? And that conversation led to me in this role. And so it's been, I thought that litigation was a, never a dull moment proposition, but this business these days is an amazing ride right now.
Yeah, well, I'm excited to hear about that. I mean, certainly my experiences with lawyers is that they are truly some of the hardest working people on the planet. There's always something going on. But in the health space, certainly this is a space where there's a lot of legally focused issues that come up. Tell me a little bit about the landscape at Novant Health and what you and the team are up to.
Sure. Let me put us in context. So we're 40,000 people, and we're, as you say, in southeastern United States. So these days, we're still coming out of COVID from a regulatory perspective. There are lots of rules that changed, lots of leeway we got that's now going back in the other direction. So we have to make sure we're included there. I mean, that we are on top of things there. The other thing that's going on in healthcare is that there are lots of combinations, lots of partnerships, lots of mergers, things like that. And so we're deep into that as well. It should come as no surprise. And the federal government, state government are very interested in those mergers. And so a good part of my day is spent thinking about antitrust concerns and ensuring that we are correct. This is a people business. Patients, employees, we call them team members, and families. And so the other big part of what we're doing these days is trying to figure out how, to recruit people to work, to retain those people, and to grow them. Mm-hmm. And then you have patients trying to ensure that they get the best experience possible. And if you think about, nobody comes to the physician, well, rarely do you go to a health system because you just want to be there. And so there are lots of issues that arise about how people feel about the experience, how they feel like they've been treated, and probably most important, us ensuring that we've given them the best health care that we can muster for them.
So it sounds to me like there's a lot of major issues that are happening right now in that broader health sphere, and Novant, being a scaled provider, is definitely right in the middle of them. You know, a couple of years ago, there was a lot of discussion on topics like privacy and data privacy. You know, where are we on some of those issues?
You've done your homework. Yes, those continue to be at the fore. You know, about every human being on the planet has a smartphone. And if you think about all the data that comes across those, a key thing is ensuring that when people connect with us, you know, asking questions, sending us information, that we keep that inviolate as it should be. The other piece of it is there's just so much information now on the internet because we connect with patients on the web. You know, we have a portal you can go in and make appointments and things like that. So there's the technical part of ensuring we've got it set up correctly, and then there's the teaching, training, and cajoling of our folks to ensure that they manage those data as they should, that they don't get loose with it or anything like that. Loose, better word is that they don't get careless in that. So yes, you're right. So in this space, we have two opposing things. On the one hand, we've got all these data points that are swimming around out there. At the same time, our customers, our patients, and their families are more and more accustomed to doing business through data on the internet. And so we have those two opposing forces. We sit in the middle of those opposing forces, making sure, and that's a non-starter. That's a no zero tolerance. It's got to be private. It's got to be inviolate for those folks. And so a good bit of my team, I have several teams that work with me, and one of them in particular, privacy. That's what they worry about all day.
And Frank, I mean, one of the things that you were talking about before we started today was team management, team building, talent. Tell me about how you have been building your team and really kind of making sure that they move forward.
So a couple of ways. First, I guess because I came into healthcare from somewhere other than healthcare, I've made it a point to try to look for talent in unusual places, to find people who didn't have a background in healthcare. Because what I found is, having people with a different lens looking at a problem, you get questions like, well, why do we do it that way? Why couldn't we do it this way? And so that's a good mix of that. Second, I had to learn that people who go into this really have a calling, particularly the patient-facing folks. They come to this because they are called to this work. And when you understand that, you understand how passionate they are. So then we have to spend, we focus on ensuring that people have the support they need so they don't get burned out. I think the last 3 years we've just gone through, so figuring that piece. And then third, we hire people from the same pool that everybody else does. And so the price for everything, including talent, is going up. Yeah. And so we're working on our company thinking about creative ways to pay people, incentivize them, and benefits that they care about so that they will stay. And each one of those things presents its own challenges.
So you mentioned that you grew up being kind of a Perry Mason fan and talking about the love of the field of law, and you've clearly succeeded in that in your career, Frank. But when you think about what drives this passion for what you do, where do you think that truly comes from?
I think, a couple of places. I think one, if a health system like ours, I mean, we're one of the largest employers around. I've spent a fair amount of my civic life thinking about economic development and how things work. So one passion is, as I chaired one time a group that worry about economic development in North Carolina. We found that in order to grow a healthy community, you've got to have a healthy health. You've got to have healthcare readily available. So when you think about me now in this role, what drives the passion is I get to help grow this region. When we're successful, we pay, again, every 2 weeks, we pay 40,000 people. And you think about what that means in terms of the economy. So there is that. And then the other one, and I didn't really understand this until I was here. And I got here in, January of 19. And then, of course, COVID hit in March of 20. And so I got a real immersion in what it looks like when everybody's on point. What this company does matters. I mean, we do everything from bringing life into the world to ushering people out in a dignified way. So I have to say I'm really proud of the work we do, and I am also just energized by having a small part in helping families be healthier and have good lives.
Yeah, and I mean, as you said, it plays such a critical role, not only on all of those moments in people's lives, but to the broader community. I mean, 40,000 jobs, that's a lot. So, I mean, Frank, when you look forward here, I don't really like to talk about the long-term future. I focus more on what I call the near future. What do you think the near future looks like for Novant Health and really some of the legal topics that you guys are focused on?
That is the question of the day. Let me list them in order. So, one, I can tell you with certainty that the number of health systems today will not be the same number in 5 years. There will be fewer. And so, when you think about legal issues, it is how do we keep this company healthy, protected, and have the ability to grow in a way that antitrust enforcers and others will see as appropriate. That's one. Second, as technology continues to change, we've got to make sure that we're on top of, and frankly, at least keeping up with, if not ahead of the game, in terms of figuring out different ways to provide care. So, everything from digital portals where you can call your doctor, and she can tell you things, to just using AI to anticipate what's going on with your body, or even if you're in one of our facilities, think about this. 10 years ago or 15 years ago, there was a nurse standing by the bed taking vital signs. The world is moving now to where you might, instead of having a number of nurses, you might have one person monitoring patients on the hall. And that comes with its own set of legal challenges, again, privacy, all kinds of things that we've got to manage. But that is clearly here. And so those are issues, I would say, in the near term. And when I say near, I mean 36 or 48 months. So I think it's going to be where it's really moving fast.
Well, I mean, I can see a lot of those forces and those changes being quite positive. There is a labor shortage across the medical professions, nursing, doctors, everything, really. And so any positive ways to use technology is great. And even maybe the consolidation will help, I mean, I don't know. I'm hoping that it probably helps us deal with some of these data issues. Nobody wants to fill out another form where we have to put our name and all of our information for the umpteenth time. So I think it's all good in that regard. Frank, if someone wanted to learn more about what you and the Novant Health team are up to, where's the best place to reach you?
I'm on LinkedIn for sure. And I would say also, or ping me on email here, or just find us here. But would love that to talk about areas of healthcare, particularly, or leadership in general, because we can learn from other industries and how they're doing things as well.
Excellent. Well, Frank, thank you so much for being on UNCAGED today. We've been speaking with Frank Emory. He is the Chief Legal Officer of Novant Health. And we've been really talking about all of the legal issues in the Novant Health space, as well as some of the broader shifts and movements we're seeing in the healthcare industry. Frank, thank you so much again, and we look forward to having you back.
Thank you so much. I really enjoyed it. Have a great day.
Cheers.
All right. Take care.